Hi, everyone. Welcome and thank you for joining us today. We're going to go ahead and get started. This briefing is being streamed live on our Rock County Public Health Department's Facebook page. It will also be uploaded to our YouTube page once the briefing ends. We'll be hearing some COVID-19 updates from our Rock County Public Health Department staff, and then we'll open it up to questions from the media. So I will now turn it over to Nick Zupan, our epidemiologist, for some data updates.
Thanks, Jessica. So before we get into today's content for the call, I just want to give you a sense of what our COVID-19 situation is in Rock County currently. So over the course of the pandemic, we have had 13,840 Rock County residents test positive for COVID-19. 95% of these individuals have recovered from their illness. Today, we're looking at about 500 active cases in the county, and this number has dropped significantly since about mid-November. So we have seen a steady decline in the number of active cases that are out in the community since mid-November, which is a great trend to see. We're also, in terms of our new cases, we're averaging about 30 new cases per day over the last week. Again, this is a trend that we're seeing a significant decrease and decline in COVID activity. We're not out of the woods yet. We still are seeing 30 new cases per day, which is a substantial number of new cases relative to what we had seen earlier on in the pandemic, but it's looking better. We have had 145 deaths due to COVID-19 among Rock County residents. And yesterday we had 19 patients in the hospital getting care for COVID-19. In terms of the vaccine has been being rolled out steadily. So we've had 16,000 individuals receive their first dose of the vaccine, and over 6,600 of these individuals are 65 and older. So we are starting to see pretty steady increases in the number of adults who are 65 and older who are getting vaccinated, which is great. This is a group that is at higher risk for more severe COVID infections. So it's great to see that those numbers are steadily climbing. We have had 4,203 Rock County residents receive their second dose of the vaccine. This vaccine is a 2-dose series. So once people have their second dose, after about 2 weeks of receiving that second dose, they have the full protection from the vaccine. Also, when we look at the number of 65-year-olds, we've had about 500 getting that second dose. Because 65-year-olds were just added to the list of eligible persons who could get the vaccine, we expect to see that number continue to increase steadily as we move forward in the next few weeks here. Just wanted to also touch on the health department updated our Rock County reopening dashboard this morning, and all of the trends in terms of case activity and testing are looking favorable. We're starting to see, as I said, a nice decline in the number of new cases we're seeing per day, a decline in the percent of people who are testing positive out of the total number of people who are being tested for COVID-19. We're also seeing pretty steady numbers of high testing rates across the county with various community testing sites available and testing available through healthcare providers. Unfortunately, we are still seeing some strain on our healthcare systems with respect to the number of patients who need hospitalization for COVID-19, on top of the other patients who need hospitalization for a variety of other health issues. So as of today, we are still seeing an indication that there's some strain on our hospital systems based on bed availability and staffing shortages. So as I said, we're not out of the woods yet with our COVID situation. We are still seeing some strain on the healthcare system, but we'll continue to monitor those trends, and hopefully within the next couple of weeks, we'll start to see additional positive trends in terms of our healthcare resources. So with that, I'm going to turn it back over to Jessica to get into today's content.
Yes, thank you, Nick. So I'm going to now turn it over to Allison Chenard. She is our Rock County vaccine coordinator, and today she'll be talking about the vaccine coordination and the distribution process. Go ahead, Allison.
Thanks, Jessica. So like Jessica said, we will be going over the vaccine distribution process from the federal level to the local level. So getting vaccines in hand and in arms is a complex process. vaccine providers complete a weekly survey to let the state know how much vaccine they are requesting for the upcoming week. They're asked to only request a 1-week supply. The state receives doses from the federal government based on their criteria for distribution. Then the state uses a formula to determine how much vaccine is allocated to each provider. Right now, the overall request from providers statewide is 3 to 4 times higher than the amount of vaccines available. For the second dose, providers do not need to request the second dose of vaccine. Each time the federal government sends vaccine to the states, they hold back the same amount to send for the second dose at the appropriate time. When the state receives the second dose shipments, they send providers the amount that matches the number of first doses sent several weeks earlier. The second dose shipment process ensures that vaccines are available to provide people with their second dose at the right time. The current authorized vaccines are a 2-dose series, meaning a person will have 2 vaccines that are spaced out over several weeks. And like Nick said, full coverage from the vaccine does not take place until 2 weeks after the second dose. The state is also participating in a federal program in which Walgreens and CVS pharmacies partnered with long-term care facilities to be their vaccine providers. The state was required to set aside a certain number of doses to put towards that program. Now, who is currently eligible to receive the vaccine right now, and who determines that? The eligibility is determined by the Department of Health Services based on guidance from the State Disaster Medical Advisory Committee. So these groups are currently eligible: healthcare workers, including behavioral health providers, funeral home workers, adult daycare service providers, massage therapists, security personnel, spiritual care providers, those that provide therapy services, and those that provide transportation to healthcare appointments, among many others. Also included are the long-term care facilities, first responders, including police and fire, and individuals age 65 and older. The next eligible group are tentatively scheduled to open up on March 1st, but obviously this could change. These groups include educators and childcare staff, individuals enrolled in Medicaid long-term care programs, some public-facing essential workers, including 911 operators, utility and communications infrastructure, public transit, food supply chain. Also, non-frontline essential healthcare personnel and congregate living facility staff and residents. In looking at our local distribution processes in Rock County, the people who are currently eligible are the healthcare workers, which includes many people who may not be traditionally thought of as a healthcare worker. So please see the Wisconsin Department of Health Services website for more details. Also, skilled nursing and long-term care residents, first responders, including fire and police, and individuals age 65 and older. For healthcare workers, skilled nursing and long-term care residents, and first responders, including police and fire, healthcare systems and pharmacies have been reaching out to these groups. Anyone in this group that has not been contacted can visit the Rock County Public Health Department's website to fill out a request form. To expedite the process, only one person from each organization should complete this form. If someone needs help getting that form submitted, for example, if someone does not have internet access, they can call 608-352-6727 for assistance. For people 65 and older, healthcare providers are reaching out to their existing patients with further instructions through MyChart, phone calls, mail, and different things that way. For those without insurance and or a regular healthcare provider, they can request vaccination by filling out a request form located on the Rock County Public Health Department's website. Demand for the COVID-19 vaccine in Rock County has been very high, while supply of the vaccine is limited nationwide. The 65 and older eligibility group is very large, so patience is appreciated. Some providers are beginning with patients age 75 and up and working in a stepped manner. Appointments will continue to be made as supply becomes available. If you do not currently qualify to receive a COVID-19 vaccine, more information will be provided as it becomes available. Just a reminder for everyone, since vaccine is currently limited and allotments may change from week to week, it may take several weeks to be contacted. Everyone who wants a vaccine will be able to get one as quickly as our vaccine supply will allow. It is important to remain patient and follow the systems that we have in place. Sometimes when people find the fastest way to try to get a vaccine, it can slow down the process. Also remember, it is important to continue to follow preventative measures like wearing a mask and social distancing.
Thank you, Allison. So now we will open it up to questions from the media. And this is our first media briefing, so we have a small number of media participants. So I will just ask that if you have a question for us, you raise your hand using the hand raise function, and we will call on you when it is your turn to speak. So it looks like Ashley has a question. And let's see, Ashley, go ahead.
All right, can you hear me?
Yes.
Excellent. Thank you all for hosting this. It's really appreciated. I hope I'm not the only media member, but if so, then I guess you'll get to know me really well for those who don't already know me. Um, So, you mentioned, or Allison mentioned, the registration form for those 65 and older, as well as healthcare workers who perhaps are not connected to a healthcare system. Can you explain to me what happens, especially for the 65 and older group, after they have registered with the form? What's the process, and what can they expect to happen, whether that's immediately or even a couple weeks later?
Do you want to take that one, Allison, or do you want me to answer that one?
Sure. So after someone submits that request form online, on our website, there is a form link. It goes into a central database. So what happens is it's looked at for the criteria to make sure the person fits the criteria that they're in that eligible group. And then you are put on a list. And this list is stored in like a central database system that all of our vaccine providers have access to, so that they can either connect with that person, or the health department can try to hook somebody up with a vaccine appointment. If for some reason you're on this list and you don't hear back, it could be because it's because of the vaccine supply, and you just have to wait a little bit, but you are on a list.
Thanks for the question, Ashley, and thank you, Allison. So now we will go to Austin Montgomery.
Hi, can you hear me okay?
Yes, we can hear you.
All right, I'm not sure who I should direct this question for, but we've seen in Winnebago County, Illinois, that they have released a registration form essentially to create like a waiting list for people who aren't under the covered groups right now for vaccine rollout. Are there any plans for something like that in Rock County to create kind of a waiting list for people who might not be eligible for the vaccine but want the vaccine? Thank you.
Go ahead, Allison.
So right now, the forms that are online are the ones that are for the eligible groups. There are plans in place to have another form available for those that we need to reach as it expands to for future groups. So yes, there will be another form that will be coming out for future groups.
Okay, thank you, Austin. Do we have any other questions from our media? Looks like Ashley McCallum has another question. Go ahead, Ashley.
Excellent. So for our 65 and older population, especially those who are on this request form, have some of those folks already been started to get connected with vaccines? And is there a priority system within that list? Is the health department working similarly as Mercy Health and SSM Health and going older to a little bit younger, or is it first come, first serve? How is that form working in that regard?
Yes, so our central database system has it where there is a timestamp that are on these requests that are coming in. So people are on a list. Also, if people are on this list, we have, like I said, the healthcare providers can go into that and look at that list to select people. This list right now is having people that are 65 and older on it. So it's based off of what the vaccine providers have planned within their organizations. And as you know, we had the Black Hawk Technical College vaccine site last week, and that's where we pulled from that list as well.
Thank you, Ashley. So it looks like Austin has another question. Go ahead, Austin.
Thanks. Just a two-part question here, one for Nick, and then just one, I'm not sure who to direct this one to, but with the rate of vaccination that we're seeing right now, is that something that is in line with other parts of the state for rollout? Is it something to where we're happy where the total number of vaccinations are? And then also, we heard that in the last state briefing that DHS isn't, the advisory committee isn't meeting. They've paused their meetings because of how large the 65 and older group is. Is there any timeline as to when new guidance might come forward? So it was kind of a two-part question there. Thanks.
Yeah, in terms of the rate at which we're vaccinating people, I think we're getting vaccines, we're getting shots in arms as quickly as possible, and thankfully we're not sitting on vaccines. So our healthcare providers are contacting us when they potentially have a surplus, so that they can connect with eligible populations and get those vaccines in arms. So, the rate is determined by our allocation. We can only vaccinate as many people as we have vaccine available. So that's kind of a limiting factor there. I hope that as we move forward, we'll start to see increases in vaccine supply across the state, so that we can start to kind of increase the rate of which we're vaccinating people. The 65 and older group is, a relatively larger group in terms of comparing it to that initial frontline healthcare worker group. We have about 28,000 Rock County residents who are 65 and older. So that, given the current vaccine allocations, that could take several weeks to get through just that 65 and older population. It kind of remains to be seen in terms of, if vaccine supply increases, we can certainly vaccinate more people, and that's kind of the limiting factor right now. But the goal is to make sure that anyone who is in that 65-year-old group can get a vaccine if they need it. They're at higher risk for severe COVID illness, and we want to prevent that as best as we can. So that's going to be the priority from here until we get most of that group vaccinated.
Okay, and then the second part of the question, does anyone want to answer about the pause of the advisory committee at the state level?
I have not seen any information on that at this time.
Okay, I'll just say that I am aware that they paused that group, and we don't have any additional details other than what the state has provided on that. Okay, looks like Ashley has one more question. Go ahead, Ashley.
Yeah, so you had mentioned last week there was a vaccine site held at Black Hawk Tech with help from the National Guard. After those 900 doses were administered, do we feel like we have a pretty good grip on our 1A folks in Rat County having been vaccinated, or has your registration form or anything else indicated that there's still quite a few people out there who are healthcare workers, whether traditional or kind of the non-traditional, who need help, or did that really satisfy what we needed at that time?
I can jump in, and Allison, if you have additional input, feel free to add that as well. In terms of the 1A group, I think the community vaccination clinic that was held last week was ideal for people who didn't have connection to a healthcare provider already, in terms of taking care of some of those 1A groups that still needed to be vaccinated but hadn't connected to their healthcare provider already. We are starting to see a slowdown in the number of responses we're getting from that 1A eligibility form, but there are still groups and individuals who meet that criteria who have yet to be vaccinated. So, we're still chipping away at that group, and certainly it helped to have that community clinic available and accessible for people. Um, it'll be kind of an ongoing process in making sure that we're getting all of those individuals vaccinated, and if they want to be vaccinated.
Thank you for the question. Do we have any other questions from our media participants? Austin, go ahead.
Not a question, just wanted to say thank you guys for doing this. I think it's something we've been looking forward to for a while, so thank you very much.
Great, and we appreciate your participation. So I think if we have no more questions, we will conclude for today. I want to let everyone know that we appreciate you being here and tuning in to watch this media briefing. This is our first one, so moving forward, hopefully we can bring in some more media partners to be involved in this. So if you are part of the media and you are interested, you can email media.publichealth@co.rock.wi.us to request to be a participant on our next weekly media briefing. These will take place on Thursdays at 11 a.m. We will be continuing to live stream them on Facebook, and after the briefing, we will be uploading it to our YouTube page as well. So thank you everyone for joining us. Stay safe, stay healthy, and be careful with this winter weather that's coming up.